All right. So again, the question was related to nebulizers and PPE that needs to be used. So certainly if we have patients who are infected with COVID-19 and they need nebulizer treatment, we would recommend use of N95s. If patients do not have COVID-19, you should consider using an N95 if you have one available to you. From the standpoint of how long after the nebulizer treatment do staff need to wear N95s when they're in the room, that's a good question. There's not necessarily data surrounding that. Certainly, we would say in absence of additional guidance, 2 hours would be potentially something to consider. We're just basing that on how long potentially the virus could hang in the air. And again, there's a lot of studies that are still ongoing with COVID-19. We're saying 2 hours. That's what we use for measles. And so again, that is not a documented recommendation anywhere, but if facilities are looking for some type of recommendation for how long to continue to wear that N95, when you're in the room after giving a nebulizer treatment, 2 hours seems reasonable to us. Certainly, if you are able to find additional guidance on this, please feel free to share it with us. We can update the group on an upcoming webinar, but that's what we think seems reasonable. Certainly, what do we do with roommates in a room while doing a nebulizer treatment? So again, as you all know, if you have a COVID positive individual, if possible, they should be in their own room, especially if they need nebulizer treatments. If that's not possible, excuse me, then it's very important that we separate, make sure those patients are separated as much as possible. If the second roommate, if there's a way to move them outside of the room during that treatment, that would be an option, although there's risks associated with moving individuals, but at a minimum, they need to be at least 6 feet apart. And again, if you've got a COVID positive individual that's needing nebulizer treatment, ideally, if they could be moved into their own room, that would be the preference. If not, obviously they need to be in a room with another COVID positive individual. And then if you can, get the patient who's not getting the nebulizer treatment out of the room for a period of time, great. If not, separate them by at least 6 feet. And again, these are all kind of situation-specific scenarios. There's not necessarily national guidance that we could point to on these. These are what we think is most reasonable. We've been getting questions related to how do long-term care facilities gain access to testing supplies to test more patients and staff. So you can request those supplies through your local public health department and local emergency management. In addition, Iowa Department of Public Health, when we have our first resident in a facility, we'll be doing a joint conference call with your local health department and your facility. Certainly, those are things that we're going to discuss on that initial call with you and try and get you supplies to do additional testing. We're getting questions about facilities that are low on staffing and asking what they should do. So it'd be important that you're talking to your parent organization if you have a parent company, or establishing agreements with staffing agencies if you don't already have those in place. Those are things that'll be critical if staffing issues arise. We got a question about, can COVID-19 positive staff work with COVID-19 positive patients? And we would not, our preference would be definitely not. And so we are continuing to recommend that any staff that tests positive be isolated in accordance with the isolation criteria that I went over on our first slide here. So really, we are emphasizing that it's important for positive staff to make sure that they're isolated and not in the facility until they meet the isolation criteria for release. The question about the screening questionnaire, I touched on that earlier. We've been getting questions about what PPE should facilities wear for well residents that are in isolation due to a new hospital stay or an admission. We're recommending that full PPE be used on all patients if possible. So that would include the mask, eye protection, gowns and gloves. So that's what we would recommend if possible. At a minimum, the eye protection and the face mask. Can residents that need someone to feed them eat in a communal dining area 6 feet apart? So our preference would be for these individuals to get that assistance in their room. Obviously, it needs to be provided in a safe environment. So if that's not possible, then you could provide that in a communal dining area as long as you've got people at least 6 feet apart. So the residents and the staff at least 6 feet apart, and there's less than 10 people in that room. So things to consider if you're going to take that approach is making sure that you're cutting down on the number of individuals that need to be in that communal dining area. And again, our preference is that people are eating in their rooms. And you should consider things like staggering so that you have a really low number of people in that area. We've had some questions about whether residents can sit outside. As long as the residents can do that and maintain that distance from other individuals by at least 6 feet, and they can be transported or they can move in and out of the facility in a way that doesn't expose others, then that's something that can happen. But again, facilities are going to have to kind of take that on a case-by-case basis based on whether they'll truly be able to isolate the residents outside. And by isolate, I mean keep them at least 6 feet away from each other. We've gotten some questions about, is temperature and pulse oximetry the only assessment that we need to do for our residents? And certainly we would recommend that facilities assess all appropriate vital signs based on the conditions of the patient, so what they would normally do to provide standard care for that patient. And so we are recommending that you screen for COVID symptoms and do temperature checks, especially in facilities that have seen cases, but you would still need to provide all of the normal, the monitoring that you would do based on the conditions and the health conditions that the patient has as well. So again, those are the questions that we've received in the past. So we just wanted to run through those quickly. Certainly, if you have additional questions, please enter those into the question and answer box on your screen. As far as additional information, again, we're getting a lot of questions related to how do people get new supplies and to do more broad testing. And certainly those are things that you should talk about on those daily conference calls with your local public health partners, and we can help facilitate that as well. We've got some questions about, we now report our census, PPE, and staffing information to CDC and CMS. We send this information to IDPH daily. Can IDPH send that information in for us? I know we've had a lot of discussions about that. We'll double check the status of that and get some information out. Would you recommend opening a window during a nebulizer treatment or an aerosol generating procedure? I think that's reasonable. As long as the window doesn't open onto somewhere else. So I think that's reasonable if you can do that in your situation. Is it possible to describe the process once you report a positive so people know what to expect? Who is handling the return to work decision? Okay, we've got a couple of sub-questions in here, so I'm just going to take them one at a time. So once you have a positive resident in your facility, then local public health in your county and IDPH will do a joint conference call with you, and we'll talk about a lot of different factors. They're really highlighted on the outbreak fact sheet that's on our website under the long-term care tab. So we would direct you to that. We've shared that with all of you in the past, so that's not necessarily new information, but we would walk through all of those discussion points with you. And then from that point on, our local public health partners will be following up with you daily to discuss whether there's new illnesses, what potential links exist between those individuals, so epidemiological links, those types of things, how you stand on PPE, on testing supplies, and whether you want to do more broad testing, those types of things. So again, after that initial conference call, then there'll be a daily touch point with your local public health partners. And one piece of information that they'll be collecting is newly tested individuals, both positives and negatives. We're asking our local health partners to identify those individuals so that we can make sure and get them tagged in our data system so we kind of know where things stand. So expect that they'll be asking for individuals, and they'll also be working with you to do some, gather some additional information for people in your facility who test positive, for your residents who test positive. As far as who's handling return to work decisions and how is the employer kept in the loop. And so certainly in many of those situations, the individuals who test positive that work in your facility are likely being tested as part of a testing effort that you're doing. So those results would be available to the facility. And again, we're recommending that people stay off work and self-isolate in accordance with those criteria that I went over earlier in the presentation. We have a question about when will hospitals start to be strike tested? So I think that's getting towards hospital partners who would like more broad testing within their facility. Certainly if there are hospitals that are interested in doing more broad testing, can reach out to their local health department and we can work with them to see what we have available for samples and help that to occur. Who sets up the call between local public health, IDPH, and the long-term care facility? Part of that's probably going to be impacted on how we find out about the situation. And so usually we'll get the report in potentially through our 800 number here at Iowa Department of Public Health. And then we'll reach out to our local public health partners and set up that call with the facility. Certainly if local public health finds out about that call, we just ask that finds out about the case, we'd ask that they reach out to us. And we can find a time that works for everyone and get it scheduled. So there's not necessarily a black and white way that has to happen, but certainly if we learn about it, we'll call local public health and connect with the long-term care facility. And we'd ask that our local public health partners do the same. There's some questions about now that some restaurants and businesses are reopening, how do you keep your residents safe if employers can go to stores and restaurants? And so again, I think what's important is continuing to do the things that you're already doing right now. So making sure that you're screening staff for temperature and respiratory symptoms, for at the beginning of every shift, making sure that you, if you've got staff, that making sure that you're using appropriate PPE with all patient care. Those things are really important as no matter where we are kind of in the reopening process. So the things that you're doing now are going to help as we start to reopen certain aspects of our state. Do we suggest that all residents and staff be tested if we don't have COVID in our building? And so from the standpoint of testing, we certainly would support, we know that long-term care facilities are really being impacted with this virus, and so we would support broad testing. However, the facility would like to pursue that, and so if you are wanting to do additional testing, certainly reach out through your local health department, and we'll work with everyone to make sure that we can get that testing available broadly. If a patient has passed the 3 days without fever and the 10 days from when their symptoms started and they're moved to a different part of the facility, what PPE is recommended? So then we would recommend that you use PPE that you're using for all of your residents. And again, we are recommending eye protection and face masks and gowns and gloves if possible. So a good question. If we consider testing all of our staff and they have to be off for 10 days because they're asymptomatic, is it safe to bring in additional staff without knowing their COVID status? Would you potentially be bringing in infected staff? So I think anytime you bring in new staff, I think that is something that to think of. But again, I think if you're wanting to test your staff and residents to know kind of where your facility stands, to make sure you understand whether there is virus circulating in your facility or not, that's something to certainly explore. From the standpoint of kind of status going forward, one thing we want to be really clear about is that's just a snapshot in time. So if someone is test PCR negative today, 2 days down the road, they may be developing disease and test positive. And so again, when we do that testing, it's a snapshot in time, but it's meant to kind of help understand whether the virus is circulating in your facility and to what extent your staff and residents could be infected. If there's a positive case in our facility, can we test asymptomatic staff prophylactically that may have been exposed and have them return to work as soon as there's a negative test result or prior to any result? And so let me take a step back from that question. So if you have a positive case in your facility and you have staff who have been exposed, what you would consider exposed, again, what we're hoping is that all facilities are able to use PPE, so there wouldn't be high-risk exposures of staff to those positive cases, because hopefully you're using that PPE with all of your patient encounters. Now, if that didn't happen and you had people who were exposed, those individuals could continue to work as long as they continue to be asymptomatic, as long as they're wearing appropriate masks, so procedure masks and N95 5s if they're doing aerosol generating procedures, if they're being screened, and there's some additional guidance that we can make sure and share. It's on our website, and I'm sure you've seen it in the past. So they can continue to work. Now, if anybody tests positive, regardless of whether they have symptoms or not, we would definitely recommend that they are self-isolating until the 10 days and 3 days fever-free. I apologize, we've got quite a few duplicates, so I'm just trying to scan through those quickly. There's some questions about, we've heard that DIA and IDPH are piloting joint infection control surveys. What is the IDPH survey and what should people expect? And so I think everyone's well aware of the fact that our partners at the Department of Inspections and Appeals are doing infection control surveys. They've done those at many facilities across the state. So in addition, there is a CDC tool and we call an ICAR, an infection control, basically consultation. And so we've done a lot of these across Iowa over the last several years. And CDC is pushing out some additional resources to do these remotely. And so we are going to be working with our partners at Department of Inspections and Appeals to see if we can kind of join forces so that when they're doing their infection control survey, that we can provide some additional resources through this consultation channel to help address maybe some of the gaps or address some additional infection control aspects that might not be included in that survey. And so we're just in the beginning process of trying to kind of join together. And the real goal here is to cut down on the times that we're connecting with all of you. We know that this is a really stressful and busy time for everyone. And so we're just trying to see if we can do this jointly so that we're both giving you a sense of kind of what some of those aspects that maybe the surveys identified as areas where you could continue to work, and then also at the same time able to provide some resources or tools to you to kind of address that. And so again, we're just kind of starting this process or this discussion, and we're trying to do a couple of pilots to see what that would look like. And we appreciate the patience of the facilities that are kind of allowing us to do that jointly with them. And certainly this is something that we can report on future webinars, but that's the goal, again, to minimize the disruption to your facility by trying to do these jointly so you don't have a lot of different connection points. So we have some questions related to rapid testing. And I think that this is related to like some of the Abbott testing tools. One thing we would say about those is that you can run one person at a time on that testing equipment, and it takes probably about 15 minutes a person to run those. And so if you are wanting to test any type of high volume of individuals, the better approach is to kind of work with us in the local public health department to try and get that testing done at one of our labs. We've just got 2 more questions. Are we still to follow the protocol for long-term care facilities reporting 2 or greater residents or staff with respiratory illness that we originally pushed out in March? And yes, we would like you to do that. So certainly if you have 2 staff members, we'd ask you to give us a call. And when you do that, we'll kind of walk through some of this guidance information with you as well. But certainly if you have at least 1 resident, then we would start this daily call process. Some questions about when we would project potentially being able to open to visitors. I don't have any kind of projection that I can share at this time. All of that is going to really be influenced by how the virus is being transmitted in our state and populations being affected. So that'll be a decision that the governor has a lot of discussion on, as well as other leadership. And so I don't have a projected forecast for that. Some feedback about just the turnaround time of the testing. I totally understand that it's hard for the families of the residents to wait 2 or 3 days for those results. But again, when we're testing large numbers of individuals, the best approach is really to try and get those specimens to the lab, so we'll get as good a turnaround time as possible. So I apologize that delay exists. We understand that that's a hard situation, but that's kind of where we are right now. All right, I don't see any additional questions, so surprising. Usually we get a lot more, but I appreciate everybody's time today. I know this has been a short call, but we'll just keep it short. Next week, we'll share some additional information potentially about kind of these joint consultations with you all. Certainly, if you have questions at the interim, please let us know, and we'll work with you to get those resolved. So again, thank you for your time, and thank you for everything you're doing to respond to this COVID crisis. We appreciate all of you.